Scent test can sniff out cognitive decline. The nose might know whether a person is showing early signs of dementia or Alzheimer's disease, a new study says. Older adults who've developed mild cognitive impairment, a precursor to dementia and Alzheimer's, score lower on appeal and sniff test than people with normal brains, according to findings published March 24 in the journal Scientific Reports. This sort of test can be taken at home to provide an early red flag for future declines in brain function, researchers say. Our goal has been to develop and validate a cost-effective, non-invasive test that can be performed at home, helping to set the stage for advancing research and treatment for Alzheimer's, senior researcher Drive. Mark Albers, a neurologist at Massachusetts General Hospital in Boston, said in a news release. Early detection of cognitive impairment could help us identify people who are at risk of Alzheimer's disease and intervene years before memory symptoms begin, Albers added. In the test, participants sniff odor labels that have been placed on a card to assess their ability to identify, remember and discriminate between different scents. People sample each odor, and then name the odor from a set of 4 options. Questions follow about how sure they are of their selection. Overall, the ability to identify and remember odors declines with age, researchers found in administering their test to a group of 127 people with healthy brains. But a small group of 19 people diagnosed with mild cognitive impairment scored even lower on the smell test than seniors with intact brain function, results show. The test results were similar across English and Spanish speakers, and participants successfully performed the test whether or not they were helped by a research assistant, researchers found. Our results suggest that olfactory testing could be used in clinical research settings in different languages and among older adults to predict neurodegenerative disease and development of clinical symptoms, Albers said. However, more study is needed to further validate the test, and to see how it might fit in with other cognitive testing for dementia and Alzheimer's, researchers noted. Alzheimer's disease symptoms and early diagnosis. Reviewed by Charles Patrick Davis, MD, PhD. Reviewed on June 23, 2021. Alzheimer's disease and dementia. Alzheimer's disease is a progressive brain disease that destroys cognitive function, memory, thinking, and reasoning. Eventually, patients can no longer carry out even simple daily tasks. People with Alzheimer's experience signs and symptoms in varying degrees. The 7 stages of Alzheimer's disease. Alzheimer's disease develops gradually. The nerve damage it causes first affects learning and memory. Stages of the disease are as follows. Stage 1. No impairment. The individual does not experience any symptoms, and none can be assessed by a professional either. Stage 2. Very mild impairment. The individual subjectively feels they forget words or common objects, but a professional cannot assess any impairment. Stage 3. Mild cognitive decline. A professional can diagnose early-stage Alzheimer's in some individuals by stage 3. Friends and family will begin to notice deficiencies. Common problems include difficulty planning, remembering names of close friends and family, and reading with very little retention. Stage 4. Moderate cognitive decline. Early-stage Alzheimer's disease. An expert will recognize clear deficiencies in several areas, including the ability to perform complex tasks like planning for dinner guests or paying bills. Stage 5. Moderately severe cognitive decline. Mid-stage Alzheimer's disease. At this stage, individuals will need help with day-to-day living as the disease creates major memory gaps. Simple arithmetic and choosing clothes may become difficult, for instance. However, they will usually know basically who they are, names of close relatives, spouse and children, and need no help eating or with the toilet. Stage 6. Severe cognitive decline. At this stage, mental difficulties continue to worsen. Individuals at stage 6 will need help with the toilet, They often become suspicious of those who help them, they often forget their identities, and tend to wander from home and become lost. Stage 7. Very severe cognitive decline, late-stage Alzheimer's disease. This stage of Alzheimer's disease deprives people of their ability to speak, respond to their environment, and eventually all motor control. Individuals with late-stage Alzheimer's need near-constant assistance for basic needs, including holding their heads up. How is Alzheimer's diagnosed? Alzheimer's disease is assessed based on several criteria. Cognitive tests of memory, counting, language, and so forth are often used. The affected person and their friends and family may be interviewed to determine changes in behavior, personality, and ability to carry out tasks. Various brain scans may be administered to rule out other possible causes, and for the same reason blood and urine samples may be drawn. With some help from the Alzheimer's Association, here are the top 10 warning signs and symptoms to look for with Alzheimer's disease. Alzheimer's disease symptoms. Memory loss. Memory loss happens to the best of us, but memory loss with Alzheimer's disease is usually worse than memory loss caused by normal aging. People with mild cognitive impairment may forget information they recently learned. They may not remember important dates or events. They may repeatedly ask the same questions to get the same information, and they need to rely more and more on memory aids, such as reminder notes or electronic devices, or family members for things they used to be able to remember on their own. Alzheimer's disease symptoms. Difficulty planning. Another sign of Alzheimer's disease is a change in a person's ability to problem solve or plan, especially with multi-step tasks. They may no longer be able to pay bills or balance a checkbook. Something as simple as following a recipe may prove challenging. It becomes increasingly difficult for the person to concentrate, and they take longer than before to complete tasks. Alzheimer's disease symptoms. Difficulty with familiar tasks. In addition to taking longer to complete tasks, a person with Alzheimer's may find it hard to complete ordinary, familiar, daily tasks such as using kitchen appliances. They may forget the rules of their favorite games or how to do their favorite hobby. Alzheimer's disease symptoms. Confusion about places and time. A sign of Alzheimer's can be difficulty orienting to times or places. A person may forget the date, the season, or how much time has passed and not understand what is happening if it is not in the present. They may also become confused as to where they are, getting lost in familiar places and not remembering how they got there or how to get home. Alzheimer's disease symptoms. Visual disturbances. In addition to problems with memory, thinking, and reasoning, another sign of Alzheimer's is visual disturbances and difficulty with spatial relationships. People with Alzheimer's may experience illusions, distortions of reality, misperceptions, for example, mistaking a shadow for a hole, and misidentifications, distinguishing between family members. Others may have difficulty with reading, determining color or contrast, depth perception, directing their gaze, and adjusting to changes in light. All these visual disturbances can affect a person's ability to drive safely. Alzheimer's disease symptoms. Visual disturbances. In addition to problems with memory, thinking, and reasoning, another sign of Alzheimer's is visual disturbances and difficulty with spatial relationships. People with Alzheimer's may experience illusions, distortions of reality, misperceptions, for example, mistaking a shadow for a hole, and misidentifications, distinguishing between family members. Others may have difficulty with reading, determining color or contrast, depth perception, directing their gaze, and adjusting to changes in light. All these visual disturbances can affect a person's ability to drive safely. Alzheimer's disease. When to see a doctor. See a doctor if you notice any of these 10 warning signs. See slides 2 to 11 of Alzheimer's disease in yourself or a family member or other loved one. The earlier the disease is detected, the more you can benefit from treatments that can delay the progression of the disease or relieve some symptoms. There are also clinical drug trials you may be eligible for which can help determine new treatments for Alzheimer's in the future. When you are diagnosed earlier, you will also be able to actively participate in decisions about your care, living options, transportation, and financial and legal matters. When you are diagnosed earlier, you will also be able to actively participate in decisions about your care, living options, transportation, and financial and legal matters. You will also be able to choose your doctors and other health care professionals, and build a support network moving forward for better care and understanding of patients with this debilitating problem. Thank you, gentlemen and ladies, for taking the time to watch today's video. Maintaining health in older age is an important journey that requires special care and attention. I hope the information and advice I shared will provide you with useful knowledge to maintain your health, live joyfully, and enjoy the golden years of your life. Once again, I sincerely thank you for your attention. Wishing you all good health and happiness. Please subscribe to the channel to motivate me to create more informative videos on health care. See you in the next videos.